Thank you for letting me have the opportunity to be here. On the House side, as we've worked through this process since the beginning of the year, let me just even take a step back and emphasize that although you read in the papers that Republicans have been obstructionist in this process right the way through, that's actually not correct. I reached out to the transition team in November, sat down with some members of the transition team, gave them things that I thought were important to America's physicians in what happened with healthcare reform. They thanked me very much. I never heard from them again. I sat down with my chairman, my new chairman, Henry Waxman, was recently elected at that point in January, made the same comments to him. I didn't leave a 25-year medical career to sit on the sidelines when the most important issue of my professional career was going on in Congress. He thanked me very much for showing up. I never heard from him again. I was invited down to the White House in March for a photo op, where they discovered I wasn't just another pretty face, and I was never invited back down. Now, we have had a bill in front of us. Really, when you stop and think about it, it's only been the second or third week in July that we actually got this big 1,000-page bill dropped in our committee. There wasn't a lot of time to pour through it and read through it, digest it, and understand it, but we did the best we could before we had the markup at the end of July. Bear in mind the trajectory was for us to be the last committee to vote this thing out and then send it to the floor and vote on it on the floor before the August recess, but that didn't happen because some members, not on my side, but some on my side was pretty much unified, but the other side got cold feet on some of the prospects that were contained within the bill. So it wasn't Republicans that slowed this down, it actually was members on the Democratic side. We all went home for August and ran full bore into a buzzsaw called the town hall meeting. Now, just to set the stage on the town hall meeting, my town hall meetings in Denton, Texas, typically in August, and I do one every year. I have traditionally since starting in Congress, typically attracts 50 people. We had 2,000 show up. We had to go from indoors in the air conditioning to outside in the parking lot, 100 degrees in August, so it was a big deal for people to come and stay through the entire meeting, but they wanted to look their member of Congress in the eye and tell them what they thought, and they weren't shy about sharing their feelings. I thought after going through this on several different rounds, and I was able to truthfully say I'd voted against the bill in committee and would do so again on the floor. That usually elicited a positive response, but there was also great concern that there was not something more reasonable being done that would take care of the problems that people were feeling in their day-to-day lives. And that's the people who have pre-existing conditions. That's the people who have been hit with insurance company rescissions. Nothing is more offensive to Americans than the concept that you can do the right thing, pay your bill, your premium every month, and then have your insurance yanked from you when you get a tough diagnosis. These reforms actually are things we could have worked on and fixed before going home in August, and yet for some reason, we chose not to. When we got back after the August recess, I honestly thought there would be a pause or a reset, and I was somewhat surprised. Our committee had an overtime period on the markup. There were 20 Democratic amendments that didn't have time to be heard because everyone wanted to go on codels on July 31st, so we came back in for a motion to instruct in our committee, which apparently is a fairly unusual procedure. I'm still relatively new, so it seemed okay to me. But during this supplemental markup, I was stunned that it was if no one had heard the voices of August. Now, my estimation, these were not manufactured events. These were not events where people were bussed in or the people that I saw were sincere in their concern. Let's be honest, they don't trust Congress to do much of anything right now. We have very little equity with the American people, and the concept that we're going to be able to successfully reorganize a seventh of the economy in a way, in an area that affects every person individually in a very intimate way through the course of their lives, the American people, at least my estimation was, they said, you don't have the credibility to do this. Now, taking a step back, certainly the president did. When the president took office in January, his popularity was so high that had he put forward any sort of bill, or had the Senate or the House put forward any sort of health care bill and voted on it in February, it would have passed, it would have been signed, it'd be the law of the land today. For whatever reason, they chose to do the stimulus first and then a variety of other things, and that brought us to August and now to September and then to October, and it's questionable whether the votes are there to pass much of anything, or if anything that passes will resemble what people thought they would get in February. It is still very much a question mark on the House side. I suspect they have the votes to pass it on the House side. I suspect H.R. 3200, which, as you recall, has individual employer mandates and a public option. I suspect all of those pieces will remain intact. I'm just not sure what the reaction will be from the folks who are now watching us very carefully to see how we handle this very important piece of legislation that, again, is going to affect every American.